So here we have my model of the knee with all the ligaments and everything. Now the ACL, it's hard to see from the back. So where you see it, it kind of attaches right here. It's easier to see when we shift over the kneecap over a little bit and just bend the knee slightly forward. And you can see how it comes all the way from the back and attaches right into the bottom bone at the front. Now, that's where it actually gets its name. It stands for Anterior Cruciate Ligament. And what the ACL does is it actually prevents your bottom bone, called the tibia, from shifting too far forward when you're doing some form of activity. It's the last line of defense from you dislocating your knee forward. Because of the fact that the ACL's primary job is to prevent that bottom bone from coming forward, when you're an athlete or any type of, doing any type of activity of, running, jumping, hopping, cutting quick, you can see how, hey, you're firing your quads quick and fast, and this bone can just slide forward just like that. That can cause an injury to the ACL. Now, despite what you hear in the media, there are many different types of grades of ACL injuries. Not all of them are tears, although that's the one that gets the most press because that's the most devastating for some of our pro athletes who we see on TV all the time. Now, what a full tear is, just so that we can cover that, is a full tear is when this whole ligament gets completely torn, and that will literally slice. And at that point, if you're an athlete and you want to get back to doing all those cutting, weaving sports, really surgery becomes the only option for that. And yes, the surgery is a lengthy surgery because we need to take time to let the ligament heal before we get you back to doing full activities. However, there's another grade just below that called partial tear. Now, a partial tear of the ACL is you'll start having little fraying of the entire ligament structure. It looks a lot like a really old rope that you'll see, holding a boat or, one of those in a fishing village, kind of little fray, little microfibers everywhere. Exact same image, partial tears all the way around. It's not that you get like one partial little snip on one portion of the ACL. The final thing, the one that you don't hear about very often, is just the general strain. And this is when, you're an athlete or someone, if you're, someone walking, your knee buckles really quickly, your knee kind of swells up, becomes painful, but you're walking pretty well and you're feeling very good. At which point in time, the recovery for that, a little bit of therapy, working and focusing on strengthening the hamstrings, which also prevent this bone, the bottom bone, the tibia, from going forward, working on some swelling management. All that can get you back to where you want to be without surgery for just a simple strain of the ACL. So what we're doing here is we're teaching my friend Cassidy how to do a proper squat. A common mistake that you see when people do squats is they'll have their kneecaps go all the way over their heels when they put too much weight on the balls of their feet. What I'm educating her on is how to properly put her weight onto her heels and keep her knees and coming down to a sitting position. It activates your hamstrings. Your hamstrings will then naturally pull that tibia back, keep your knee in proper alignment, and help build and strengthen and protect your knee from any type of injury to the ACL. So similarly, what we were talking about, weighted leg raises. When we do these, we're trying to focus on the hamstrings. When you're always working on protecting the ACL, you want to focus on the hamstrings, and this is one of our simple but easy and effective exercises to strengthening the hamstrings. So in this exercise, we're utilizing one of the machines that we have in the clinic. This machine allows us to really kind of build and increase the weight and the resistance to the hamstrings. The first exercise with just the standing hamstring curls is more of a basic exercise. This one gets a little bit more advanced because we're able to keep increasing that resistance, really strengthening that hamstring, and this is a more aggressive exercise for patients who might have injuries. In this exercise, this is one of my favorite exercises for working with anyone who has any type of ACL or in general knee injuries. It really works on activating the hamstrings, also works on endurance. Although it looks like a very simple exercise, if you notice Cassidy is having some funny facial expressions while doing it, but it's a very strong, strenuous exercise, and it's great for athletes. It's even something that you can do at home or in the office. People may give you a funny look if you do it too far out of your cubicle, but it's also incredibly effective.